classification. Cataract is defined as any opacification on or inside the lens. On means on the capsule, and inside the lens, either it may be cortical or the nuclear cataract. Functionally, it includes only those cases which interfere with vision. The rest of the cataract cases are not considered. Functionally, functional classification, it's only includes those cases which interfere with the vision. Clinically, it is the opacification of the lens which obstructs the normal red glow of the fundus by doing the distant direct ophthalmoscopy. What is the anatomy of the lens? It is located just posterior to the iris and anterior to the vitreous. The shape of the lens is biconvex. It is having lens capsule, lens cortex, and a nucleus. And what is the physiology of the lens? It derives the nutrients from the aqueous humor, as it is not having any blood supply. And also the other feature is not having any nerve supply also. So no vessel and no nerve supply, leading to the transparency by means of some pumps which are acting on the lens epithelium. It is having the main refractive function. It bends the light rays to focus onto the macula. It is also having the accommodative function. What is accommodation? The bringing the far point to the near point. అంటే మీరు దూరంగా ఒక పర్సన్ కనుక చూస్తూ సడన్ గా పుస్తకం చదువుతున్నారనుకోండి, అంటే బ్రింగింగ్ ద ఫార్ పాయింట్ టు ద నియర్ పాయింట్ వైల్ రీడింగ్ ద బుక్స్ అండ్ సీయింగ్ ద డిస్టెంట్ ఆబ్జెక్ట్ ఈస్ కాల్డ్ as accommodation. And it's the main accommodative. The accommodative function, it is due to the alteration in the shape of the anterior curvature of the lens. Okay, no immediate relation to the adjacent structures it's having. The mechanism, metabolism is very complex, and even the simple disorders lead to loss of transparency and also the location change of the lens. What is the location change? It may be displaced anteriorly or posteriorly or may be subluxated. And why the cataract is formed? General mechanisms of the cataract formation and the cataract's varied etiology have some common mechanisms, but even though the etiology is varied, but there are some common mechanisms in the formation of the cataract. What will happen? Previously, the lens is having all transparent lens fibers only, but what will happen? It may be opacified during the course of the development, maybe due or in the adult life also, maybe due to the metabolic defects, just like diabetes and in such cases, in the diabetes and galactosemia, that is the metabolic disorders, the subcapsular cataract is involved. Okay, and this opacification, previously the lens is clear in the case of the diabetes and galactosemia and the metabolic disorders, and also in cases of the trauma, before trauma, the lens fibers are normal, but after some time, after trauma, what will happen? The D fibers may be affected because of the coagulation of the protein. That is, the oxidative damage also occurs as in case of the cataract, senile cataract. Whereas in the case of the trauma, because the epithelium is damaged, the imbibition of the fluid into the lens fibers may lead to the opacification of the hydration and leading to the opacification of the lens. Okay, opacification of the, that means metabolic defects, trauma, and the oxidative damage lead to previously clear lens fibers to opacify. Metabolic defects like the metabolic disorders, whereas the mechanical problems like trauma, and whereas the natural course of the aging process, that is the oxidative damage. And the formation of the new opaque fibers. Just we discussed the previously the clear fibers opacified, but in this case, the new fibers itself opacic formed as opaque fibers. This is due to the toxicity in the embryonic or the fetal development of the legs, resulting in the congenital cataract. That means congenital cataract, the lens fibers are formed as opacified fibers. A similar mechanism causes after cataracts also, as in the case of the cataract forming operation. Deposition of the granular material instead of fibers. In the congenital cataract, the fibers which are formed are opacified fibers, but here this is a disorder in which instead of the fibers, the granular material is deposited in the place of the lens. For example, radiation, metabolic, and some toxic cataracts damaged. Why it is formed? This is due to the damage of the lens epithelium, so that from where the lens fibers are formed, from the epithelium itself. Because the epithelium is damaged, it cannot give rise to the lens fibers. So what will happen? It lays down a granular material instead of the lens fibers. So what will happen? Opacification of the lens also occurs in this case. This occurs in both the anterior and the posterior poles by means of the mitotic flow posteriorly. Then accumulation of the, here the granular material is formed. There is another problem due to some, it is due to the age related, it may be age related. And here a pigment occurs in the cataract, in the lens, that is the nuclear cataract. So that when the pigment deposition occurs due to the aging process, that is called as nuclear cataract, and it's age related, and it's also due to the exaggerated nuclear sclerosis. Excessive pigment may produce the brunescent or the black cataract. Then opacification of the lens epithelium. And for epithelium, opacification of the lens epithelium may occur in glaucoma, and it is due to the trauma as the silent killer of the optic nerve head, that is the glaucoma. When there is the whenever there is a IOP is raised, it will lead to the epithelial damage. So what will happen in the on the lens? There is a formation of the epithelial opacification. That is the glaucoma flecken. In case of the trauma, punctate cataracts, or due to the chemical injury also, there is opacification of the lens epithelium. That means the epithelium is damaged in case of trauma and the glaucoma and also the chemical injury. And that deposition of the extraneous material. Deposition of the some metabolites may occur, as in the Wilson's disease. That is, the copper deposition occurs on the lens capsule, or in the chlorpromazine, some drugs also. It leads to the after metabolism, the chlorpromazine gives rise to some material which is deposited on the capsule. Then classification. The classification, it may be the congenital or the developmental cataract. And acquired cataract. Acquired cataract is due to the pathology, and whereas the congenital cataract is due to the problems which occur in the antenatal period. Okay, when the baby is fetus is still in the womb. In such cases like the rubella and all, that is due to the infection, and also when exposed to the X-rays and all the things will lead to the formation of the epithelial damage leading to the cataract, either anterior polar or the posterior polar will occur. Whereas the acquired cataract is so many reasons are there to form the cataract. That is, it is the most commonly, it's the age-related problem leading to the lens became old. That's why it leads to the formation of the cataract. And whenever there is a trauma, then leads to the cataract. And whenever there is a complicated cataract, just I told you that is the diabetes, that is the subepithelial tissue cortex will lead to the formation of the opacification, and also the metabolic cataract and the complicated cataract, posterior subcapsular cataract is most common, as in the case of the diabetes. And that is metabolic cataract is the diabetes and the galactosemia and occurs, and also the radiational cataract, that is the exposure to the X-rays and all the things, and the toxic cataract as in the case of the uveitis, and the metallic foreign bodies. Toxic cataract, it may be drug-induced, the steroid-induced cataract. When we use the steroids for the prolonged period, as in the treatment for the uveitis, and are some other reasons as a systemic disorder like SLE and all the things, when the medical physician prescribes the steroid for the prolonged period, it may lead to the cataract formation and the mitotic cataract. And the metallic foreign bodies, that is the iron or the copper, whenever foreign bodies are impregnated onto the foreign body, penetration occurs, that it may be removed, but the iron particles are still on the in the AC or in the anterior capsule, led to the centrosis and chalcosis, the copper. And the dermatogenic cataract, cataract associated with some bone diseases also, the cataract, the miscellaneous diseases and dystrophia myotonica, Down syndrome and others, and so most of the other symptoms you need not worry about them. And whenever the muscle is involved, and also in the mentally retarded, as in the case of the Down syndrome also, the cataract is present. And this is all the etiological classification. Here the morphological classification. Morphological classification is the capsular, subcapsular, cortical, supranuclear, sutural, zonular, or the lamellar. Okay. Capsular, it may be the polar, it's the center of the lens. That is, it may be anteriorly opacification, there may be the posterior opacification or the bipolar opacification, or the generalized capsular opacity may be seen, and whereas that is most commonly seen in the glass blowers, which is more common at the place, that is the Venice, where they do used to do the glass works more, and the post subcapsular cataract, that is the posterior, that is the cupliform or the rosary cataract. And the dermatogenic cataract, the cataract associated with the bone diseases is already repeated. And the toxic cataract, what is this? Oh. And the cortical cataract. The cortical cataract, in some cases, only the anterior fibers get opacified, whereas in some other cases, only the posterior layers of the lamella are only opacified. And in some cases, the only equatorial region gets opacified. That is called as in the form of the cuneiform or the wedge-shaped cataracts, blued out cataract. And the supranuclear, deep perinuclear cortex, that is the coronary, that is perinuclear, just the around the nucleus, that is the nucleus of the lens, there is opacification, it is called as coronary cataract. Nuclear or the pulvirent or the sclerotic cataract. And sutural, various patterns occur in the sutural cataracts, just like coralliform, floriform cataracts, and the embryogenic sutural cataract also occurs in this. And the zonular or the lamellar. The lamellar, it may be the nuclear or it may be the cortical. Then what are the symptoms associated with the cataract? The most common thing is the patient, the only function of the one function of the eye is the visual function. So the main symptom which is associated with the cataract is the decreased vision. It is most obvious and it's very important also, because without vision the patient cannot survive in the world happily. So decreased, and the other functions of the other forms of the, what are the other forms of the vision? That is, it's with the form vision. That is, the decreased vision is some type of the form vision, and the contrast sensitivity, and that is color vision also. And the three parts of the vision are involved in the cataract. There is decreased vision, there is poor color discrimination, there is a decreased contrast sensitivity in the case of the cataract. And also because the lens, the main, it acts as the refractive medium. So whenever there is formation of the some extraneous materials or the opacification, it lead to the refractive error, either in the form of the myopia or in the astigmatism. The other thing which the patient experience, which is very troublesome to the patient, is the diplopia. The diplopia is the monoocular diplopia or the multiple vision. Sometimes when the patient, that the person with the cataract drives in the night, they will experience glare. They cannot see when the car is coming in front of this uh, person who is driving in the opposite direction. What will happen? So I cannot see the things clearly. Why? Because due to the glare which occurs due to the scattered light rays. And then what are the signs? What the patient tells is the symptom, and what we elicit is the sign. So the previously we did the no, I discussed about the symptoms only. Now we have to elicit whether it is due to the cataract or not. The decreased vision is whether due to the cataract or not. The signs, the lens is the best examined with the dilated pupil, and a magnified view of the lens can be obtained by the slit lamp or by using the distant direct ophthalmoscopy with the high plus setting, 10 plus. Then acquired cataract. But the acquired cataract, most common cause of the acquired cataract is the senile cataract, that is the age-related cataract. As the person is nearing 50 years, usually most of the people uh, will experience some fall of the vision. When such a patient is examined with the distant direct ophthalmoscopy, the poor glow is there, the red glow is absent. That is the senile age-related cataract, opacification of the lens in the advancing age, usually above 50 years. And what is any male and female predominance is there with the cataract? No, there are equal frequency in the males and the females, and it is known to be occurring 5 to 7 years earlier in India and the tropical countries. That means that is the UV radiation may take part in the formation of the cataract. It is usually of the three pure types, that is the nuclear cataract, cuneiform cortical cataract, cupuliform cortical cataract, and the posterior subcapsular cataract. But usually it occurs in the mixed forms. Not pure forms are rare, and they say that nuclear and the cortical cataract combinedly may occur either in form of the posterior subcapsular, that is the cupuliform, or the cuneiform cortical. Then what are the causes for the occurrence of the cataract? It may be heredity, and in some families, at the age of the 40 itself, they experience the formation of the cataract. When a person, for a particular person in a family, the cataract occurs at an earlier age, then the other persons also think that when there is an blood relation, the heredity may take part. So they should be more cautious about the dehydration and the risk factors which are associated with the cataract should be doctor should warn them to avoid these risk factors. And that is like nutritional factors, dehydrational crisis, environmental factors, advise them not to work too much in the hot weather, and also the constitutional factors and poor economic, socio-economic, they advise them to take the balanced diet. And heredity. The incidence and age of the onset of the cataract is known to be genetically determined, and slightly earlier development of the cataract in some families. Nutritional factors, protein deficient diet with the deficiency of the vitamin C and E are likely to be associated with the cataract formation. Some studies also shown that the excessive drinking of the milk may also act as an aggravating factor. So we have to advise them to take the balanced diet, like protein-rich food, and also the vitamin C and the E is should be prescribed for these patients whenever these people are not taking the proper balanced diet. Dehydrational crisis, severe diarrhea causing dehydrational crisis, and it is also leads to the accentuation of the senile. And environmental factors, higher prevalence in the tropical and the hilly areas due to the ultraviolet radiation of the ultraviolet radiation. Ultraviolet radiation leads to the cataract formation, and this could be due to the oxidative damage of the proteins. Then constitutional factors, hypertension. Hypertension may be associated with higher incidence of the nuclear cataract. And the poor socioeconomic status. Why in the poor socioeconomic status this cataract occurs? Because of the things which we discussed is exposure to the ultraviolet radiation, not taking the balanced diet, and dehydration, not taking the proper intake of the water, and all these cases, because they are not aware of the risk factors, and also they have to do work in the for their livelihood in the hot summer or the hot weather, so that exposure to the ultraviolet rays lead to the cataract formation, especially in the poor socioeconomic group. And the biochemical basis of the cataract genesis. The cataract, what is the biochemical basis? Cataract is the process of the lens opacification. That is due to the derangement of the carbohydrate metabolism. What will happen here? The soluble sugar, that is the hexose, is converted into insoluble sugar, that is the sorbitol. How it is formed? By aldose reductase. So increase in the osmotic pressure of the lens will occur. This causes hydration and the lamellar separation and disruption of the cell membranes. Okay, then protein metabolism. The oxidative damage of the SH group of the amino acids or the proteins by the free radicals produce disulfide linkages. What will happen when the disulfide linkages are formed? Long chain amino acids are formed. So these convert the small chain proteins to the larger ones, producing the opacification. The role of the UV light and the age-related decline in the ability to maintain the reduced glutathione. That is why the glutathione is important here. It acts as a protector of the oxidative damage. Okay, so deficiency of the oxidative antioxidant vitamins, just like vitamin C and the vitamin E, and all are implicated in the formation of the senile cataract. So one should prescribe vitamin C and the E to the patients above the 40 years of the age, especially those who are working in the, that is belongs to the poor socioeconomic status. Okay, then another cause is the sodium potassium pump implication is also there. The active, it is the energy dependent pump which controls the lens metabolism. Why? The lens is not having any blood supply. So what will happen? It depends upon the aqueous humor. So the actively the nutrition should get through active pump, that is the sodium potassium pump. It also alters permanent. It also alters the permeability of the lens caps. This may be the another mechanism of the cataract formation and leading to the hydration of the lens, which further damage lead to the protein derangement. That means any carbohydrate derangement and also the protein metabolism defects also lead to the cataract formation. Here we have to observe one thing. It may be due to the metabolism of the carbohydrate and the protein and also water. Water means in case of the dehydration, the cataract occurs. So the carbohydrate, protein and water, we have to concentrate on these three metabolisms. And so we accordingly, we have to advise the persons to take care of the risk factors and age-related cataract. What description? The most common type and the most patients are beyond their 50. The incidence goes up with age. It's the first rank of the ophthalmic diseases leading to the blindness. What are the risk factors? I already discussed age, occupation. Sex is not relevant. It's equal in both male and the female. And ultraviolet radiation and metabolic disorders and a systemic disorder like hypertension and a positive family history and a nutrition condition. And the types of the senile cataract. Senile cortical cataract, nuclear or the sclerotic cataract. What is the cortical cataract? Why it is formed? And the hydration followed by the coagulation of the lens in the cortex. The most, in the acquired cataract, what is the main pathology? It's the coagulation of the lens proteins. The coagulation of the lens proteins occurs due to so many reasons like dehydration or the excessive hydration, dehydration and hydration also. Dehydration as in the case of diarrhea and hydration occurs as in the case of the trauma to the lens capsule. Okay, and then coagulation of the proteins. Why the coagulation of the proteins occur? Because the lens is mostly made up of protein only and few crystalloids are present. And so, what are the stages of the cataract? That is the cortical cataract. Then there are 4 stages. Then the stage of lamellar separation is the first stage, and the stage of the incipient cataract, mature senile cataract, and hypermature senile cataract. Then coming to the stage of lens lamellar separation, demarcation of the cortical fibers owing to the separation of the by the fluid. We can see the cortical fibers separately. There is a gap between the cortical fibers by the deposition of that is the imbibition of the fluid. It is demonstrated by the slit lamp examination only. The naked eye cannot see. And that how it appearance is just like gray in color and in the place of the pupil. And the changes are reversible. At the stage of the lamellar separation, the changes are reversible. And stage of incipient cataract, the wedge-shaped opacities with the clear areas between, that is the lens stria. Okay, wedge-shaped opacities are there with clear areas between the wedge-shaped opacities. They are called as the lens stria. The most common in the periphery and in the lower nasal quadrant. Okay, incipient cataract, we have to examine under slit lamp the lower nasal quadrant, because the incipient cataract most commonly first appears in the lower nasal quadrant and is only seen in the dilated pupil early stage, so that we have to dilate the pupil. Irregularities in the refraction, because the fundamental function also, in addition to accommodation, the main function is refraction and the bending of the light rays, because the deposition or hydration and opacification abnormalities, these irregularities lead to the refraction irregularity. So the visual deterioration also occurs, and also because the lens fibers are separated and each lens fiber acts as a lens, so there is the polyopia. Then immature senile cataract. Opacification becomes more diffuse and irregular. That means the disease, that is the senile cataract, is progressing. So that becomes more diffuse. Instead of the peripheral opacities or the early nasal, lower nasal opacity becomes more and diffuse and it's irregular. Then in such immature, the lens, because the opacification opacified, the lens is swollen also. The iris shadow is still visible because there are still more immature fibers out there. The anterior chamber becomes shallow. Why? Because the lens is enlarged. And see in the slit lamp examination, the lens is opaque, anterior chamber becomes shallow because the lens is pushed into the anterior chamber. So the anterior chamber becomes shallow as partly it is occupied by the lens. Then the mature senile cataract. Complete opacification occurs. The whole cortex is involved. So there is no iris shadow at all. The lens appears pearly white in color. It's also known as ripe cataract. What is hypermature cataract? Cortex is disintegrated and transformed into pultaceous material. It is of two types. That is the Morgagnian hypermature cataract and the sclerotic hypermature cataract. What is Morgagnian hypermature cataract? Complete cortex is the entire cortex is opacified, liquefied, and appears as milky white in color. And the nucleus is settles down at the bottom because the lens support ఉండదు, the cortical matter support ఉండకి ఏమవుతుంది, lens nucleus is somewhat it's loosened from the adjacent cortex and separated from the adjacent cortex and it's heavy and sinks to the bottom because and it's the calcium deposits may be seen on the lens capsule. Sclerotic hypermature cataract, disintegrated cataract, the cortex, shrunken lens, and whereas a wrinkled anterior capsule is there in this case, and this is the dense white capsular cataract in the pupillary area and the deep anterior chamber. Okay, where in the immature cataract, what we see in the anterior chamber, the shallow anterior chamber. Whereas in the sclerotic, even though it is hypermature, the anterior chamber is deep. Why? Because it is a shrunken lens. Whereas in the immature cataract, because the lens is swollen, the anterior chamber is decreased in depth. Whereas because the lens in the hypermature, sclerotic hypermature cataract is shrunken, it lead to the deep anterior chamber and the tremulous iris because it's not having the proper it's not have the what is this the zonules which are present at the equatorial region of the lens because the lens is shortened, it leads to the tremulous iris and the nuclear sclerotic cataract. What is the cause for the nuclear cataract formation? Intensification of the age-related degenerative changes lead to dehydration and compaction of the nucleus. Here, the dehydration is the problem. Okay, whereas in the cortical cataract, the carbohydrate or the protein, the nuclear protein, what is this coagulation is the cause. Whereas in this case, the dehydration and compaction of the water metabolism is at fault, the compaction of the nucleus. And the features, what are the features? Nucleus, it's the hard nucleus is formed and a significant increase in the water insoluble protein. The lens becomes inelastic, so the accommodative power is lost. And so the loses the power of the accommodation. Changes begin centrally in the place of the nucleus and slowly spread to the periphery. Central vision is lost. So what will happen? The vision, when the bright light is imposed on the pupil, what will happen? It's constricted, as in the case of the daylight. So because it is formed centrally, in the daytime, the patient complains of the decreased vision and he is able to see more clearly in the dim light because the periphery begins centrally and slowly spreads to the periphery. So the central part is first involved. So the patient complains of the decreased vision in the daytime. Deposition of the pigments gives rise to the color of the nucleus. There's the nucleus sclerotic cataract. You see the brown cataract here. And the other types of the nuclear or the sclerotic cataract, the cataract brunescens and the cataract nigra, still more dark in color, that is the black, and the cataract rubra. And the complication of the senile cataract. The complications, what are the? That is the uveitis also occur with the lens. That is the phacoanaphylaxis uveitis. The patient is complaining of the pain and unable to see the daylight light, and blepharospasm will occur and complaints of the pain and decreased vision. This is due to the phacoanaphylaxis uveitis, and also the lens. It also lead to the glaucoma. That means the patient due to cataract, the uveitis may occur, the glaucoma may occur, and also the lens may be finally dislocated or subluxated. Okay, it is not the simple cataract. The cataract will lead to the adjacent structure involvement also, as the iris may be involved, that is the uvea is involved, that is the uveitis, and also that is the glaucoma may occur because of the imbibition of that is the lens by ఏంటండి ఏంటిది రిక్వెస్ట్ and the congenital cataract అనేది పర్లేదు ఎక్కడ వచ్చింది నాకేం కనిపించట్లేదు. Okay, congenital cataract. Then what are the features? It is present at the birth and shortly after birth the patient baby develops cataract, and it may be the unilateral or bilateral. Even though it is the birth congenital cataract, sometimes it is the unilateral problem, or it may, in some cases, bilaterally the cataract is present and may be present cataract alone, or may be associated with other ocular or systemic congenital abnormalities, because it's mostly related to the toxic etiologies in the rubella and also the maternal complications like that. And so the etiology, the hereditary factors, that is the glaucoma, that is the gene, and also the chromosome is at fault. So the cataract is formed. And environmental factors like pregnancy and the virus infection. And so when the early stage in the first trimester, when the infection occurs, as in the case of the viral infection rubella, it lead to the formation of the cataract. And some drugs, I already told you, like chlorpromazine, and also the drugs which are used for the prolonged periods, the steroids, will lead to cataract formation. And some metabolic disorders like diabetes and the systemic disorders are not applicable here. It is only for the senile cataract. And some we cannot determine some causes also. Even then, when in some patients, the babies, we cannot point out what is the reason behind for the formation of the cataracts. Classification according to the location, form, and the degree. It may be the anterior polar and the posterior polar, or the perinuclear, and the coronary cataract. What is coronary cataract? It's just superficial, just adjacent to the nucleus. And then punctate cataract and the total cataract. It may be membranous cataract, which is present on the anterior capsule, and it is the nuclear cataract also. Even though it is congenital cataract, nuclear cataract also. See this picture, this is the anterior polar cataract. There's the slit lamp, and the beam is slit beam is applied on the cornea. You see that there is a opacification on the anterior part of the lens, that is the anterior polar cataract. This is the posterior polar cataract. You cannot see this. It's only with the slit lamp examination only say. Can we see? And this is the perinuclear cataract. What is that? Other name? That is the coronary cataract. And use. That is the punctate cataract, blue dot. And this is the total opacification of the lens, milky white in color. And this picture is membranous cataract. The anterior capsule is opacified and just like the membrane. That's the membranous cataract. You see only the anterior part is clear. That is the lens fibers in the slit lamp examination. But only the nucleus, that is the oldest lens fibers, are opacified. That is the nuclear cataract. Then what is complicated cataract? Any inflammation or the degenerative disorders. It may be in the form of the nutrition or the metabolic defects lead to the lens formation, opacity formation. What are the common causes? It may be due to the corneal ulcer, and what the every disorder, what you know, will lead to the what is that complicated cataract formation, like corneal ulcer, that is the glaucoma, uveitis, retinal detachment, and the retinitis pigmentosa, intraocular tumors, and even the refractive error, the high myopia also lead to the cataract. సో ఇప్పుడు మీరు చెప్పేది ఏంటి? మీకు తెలిసిన డిసీజెస్ పేర్లన్నిలోనూ చెప్పేసిన ప్రాబ్లం లేదు, వాటన్నిటికీ మీకు cataract ఫార్మేషన్ అనేది వస్తుంది. కార్నియల్ అల్సర్, గ్లకోమా, యువైటిస్, రెటినల్ డిటాచ్మెంట్, ఈవెన్ ఫ్రమ్ ద యూయా టు ద రెటీనా. ఓకే, there is the formation of and clinical findings. And the primary disease, one minute. Okay. And the primary disease changes. Clinical. What are the clinical findings? This is due to the disease itself, and also due to the primary disease changes like diabetes and all the things, and the trauma, and also the cataract due to the cataract also. And what is the treatment? We have to treat the primary disease first, and then do surgery after 3 months of the inflammation control, as in the case of the uveitis. Then metabolic disc cataract. Then there is the diabetic cataract, galactose cataract, and due to the lack of the enzyme, and the tetany, as due to the low calcium in the blood, and also due to the some diseases like Wilson's disease. There is the it lead to the cataract formation. That means every disease mostly involved in the formation of the cataract. That means any damage, it may be the oxidative damage or maybe mechanical damage, and which lead to the coagulation of the proteins. Whatever may be the cause, any coagulation of the protein, the factors which lead to the coagulation of the protein will lead to cataract formation. Okay. And some metabolic disorders also lead to cataract formation. For example, in the Wilson's disease, we have to see the KF-ring, and also the typical appearance is there in this sunflower shaped opacity is there, and it is due to the proper metabolism. And then diabetic cataract. What is the mechanism? Whenever the blood sugar is raised, what will happen? Sugar in the lens also, sugar levels in the lens also changes, because it is mostly the sugar which is present in the aqueous humor will imbibe into the lens because it is not having any blood supply. So the aqueous, whenever the blood sugar levels are more, the aqueous also has having the higher level of the blood sugar. So what will happen? In the lens also the sugar levels are increased. So changes occur. What is that? That the soluble sugar is converted into the insoluble sugar, that is the sorbitol by the aldose reductase, and the plasma. So that what will happen? Osmotic pressure will increase, and that lead to the absorption of the water. So the lens fibers are swollen and they are degenerated in due course and lead to the lens fiber opacity. Then, what is the classification of the metabolic disorder? There is a real diabetic cataract and the age-related cataract of the diabetic patients. Clinical findings, that is in the real diabetic cataract, what will happen? It occurs in the teenagers and it is type 1 diabetes, and it is usually bilateral and rapidly progressive and leading to total cataract formation and combined with the refractive changes according to the blood sugar levels. Okay. And then second type, that is the age-related cataract of the diabetic patients, that is high incidence and start earlier and fastly it will progress, and progression is very fast and lead to the mature and similar with the senile cortical cataract. Then what we have to do? We have to treat it. How? Then positively treat the diabetes and control the blood sugar first and do the surgery if permitted, and then positively post-operational infection and the bleeding also should be prevented in these cases. And the drug-induced, that is the toxic cataract, that is the corticosteroids, chlorpromazine, and meiotic cataract like the pilocarpine, and the metals and dry nitrogen cataract also occurs. This is the picture. And the traumatic cataract. The classification, that is the contusive cataract and penetrating injuries and chemical injuries and radiational injuries and any electric injury, any trauma to the lens will lead to cataract formation. The treatment, we have to observe whether the decrease in the vision is there, whether it is progressing fast, or if it is the patient is able to do his work routinely, routine work, then we need not intervene at the earlier stage. We can observe, and then only if the patient unable to do his work, the routine work, then only we have to practice surgery. Then secondary cataract. What is secondary cataract? Opacification of the posterior capsule due to the partially absorbed traumatic cataract or following the extracapsular cataract extraction. And even we did surgery for the cataract. But after doing the surgery, after the surgery also, the posterior capsule is opacified. That is the posterior capsular opacification. And it is the most common complication of the cataract surgery. PCO. And then clinical findings, decrease in the vision after the cataract surgery. And the opacification, what we observe are L-Schnick pearls. And it is a significant problem in almost all pediatric age group patients. Unless the posterior capsule and the anterior vitreous are removed at the time of the surgery, most of the pediatric age group patients are complained of the decrease in the vision again, even though we did the surgery. So what we have to do in the post congenital cataracts and in the younger age group children, what we have to do, the posterior capsule, we have to remove the posterior capsule as well as the anterior vitreous to avoid the posterior polar PCO formation. Up to 30 to 50% of all adult patients develop an opaque secondary membrane after the cataract surgery also. The incidence of the PCO is up to 50%. Then what we have to do for such cases in adult PCO, patients of PCO in older age group after cataract surgery, we have to do VR capsulotomy. You see, that is the PCO. The treatment of the cataract, there are many kinds of the medicines, but none has certain positive effect. Surgery is the chief method. Surgical treatment will continue later.